Good evening. My name is AMorrow, and I will be presenting my book presentation for maternal and child health. The contents of my presentation are as follows. First is the introduction, then the summary on page 4, the personal reflection on page 11, the research and resource reflection on page 12, and finally my references. The body keeps the score, brain, mind, and body in the healing of trauma. Dr. Bessel Kolk describes trauma and its impact on the brain and the human body. Dr. Kolk is a preeminent psychiatrist and therapist with over 20 plus years of extensive experience in the field of mental health. The book is organized into 5 separate sections. Part 1, the rediscovery of trauma. Part 2, this is your brain on trauma. Part 3, the minds of children. Part 4, the imprint of trauma. And Part 5, paths to recovery. In Part 1, Dr. Kolk introduces readers to normal brain anatomy and physiology. In the rediscovery of trauma, he contrasts the normal brain anatomy to the abnormal brain anatomy that occurs to the brain status post-traumatic experiences. Dr. Kolk defines post-traumatic stress disorder as being a disorder in which a person experiences something that exceeds or overwhelms their capacity to cope. The symptoms of PTSD or post-traumatic stress are as follows: disassociation, flashbacks, loss of imagination, and numbing. But these are not exhaustive. These are just a few of the symptomology. Contrary to popular belief, the book describes trauma and post-traumatic stress as being not, quote, all in your head. In Part 2, this is your brain on trauma, the book describes how the body and the brain are interconnected. Trauma disconnects the mind from the body. Therefore, it is important to befriend your body in order to reconnect your mind back to your body. Trauma is like having an internal alarm system. Things that are regarded as normal, such as a back rub or a hug, trigger the alarm system to go off for seemingly unnecessary reasons. During a traumatic experience, our primitive brain becomes activated to go into survival mode and can be exhibited in ways such as the fight, flight, or freeze experience. 2 additional ways have been found to add to this phenomenon, called fawn and flock, where fawning is appealing to one's traumatizing experience or abuser, or you're trying to do stuff to appeal to seem as if you're being overly friendly, whereas flocking is to flock together in groups for safety as a means of survival. And again, all these different descriptors here, the fight, flight, freeze, fawn, and flock, are all different modes of the same phenomenon, which is the brain just being overly activated to go into survival mode. In Part 3, The Minds of Children, the book describes adverse childhood experiences. These adverse childhood experiences are also known as ACEs, have a negative impact on childhood development. ACEs affect children's ability to self-regulate, and a quote from the book that I thought was insightful was, "For abused children, the world is full of triggers." Dr. Kolk suggests that trauma is what underlies most of children's behavioral disruptions. In part 4, The Imprint of Trauma, Dr. Kolk talks about the history of psychiatry. In the early 1800s, there wasn't much understanding of mental illness and how to treat the mentally ill back in those days. People who were suffering from mental illness were locked away in psychiatric wards or in these institutions where they were isolated and separated from society and unable to receive the treatment that they so desperately needed. Things have come a long way since then, where mental health has become a lot less destigmatized and more accepted, but there is still a need for holistic treatment and comprehensive treatment, a more comprehensive approach to treating people who suffer from mental illness. This part of the book also talks about the process of disassociation, which is defined as the splitting off and the isolation of memories. Basically, when you are held hostage by your memories and put in a cycle where the memories just repeat themselves over and over. The book describes the treatment of this phenomenon with reconnecting of self. In the 5th part of the book, it talks about paths to recovery. The first notable theme that I found was how it describes the transformation that individuals undergo from being in survival mode to growing into thriving mode. Being defined as a phenomenon called knowing thyself, the book states how it can be scary to take a deep look at yourself on the inside and having to face those traumas that you endured. However, it is very necessary to do so in order to consciously change your brain's reaction from the trauma. Ways to and different methods that can be utilized to facilitate internal reflection include meditation, yoga, and eye movement desensitization and reprocessing therapy, also known as EMDR. Tapping is a way that can be used to reconnect the mind to the body. So upon personal reflection of this book, I actually have already read this book before prior to taking maternal and child health. So I had a chance to reread it again and listen to and gain more insight on this phenomenon of trauma and how it affects the human body. I was first recommended this book in 2020, 2021 by my therapist at the time when I was working in the Psychiatric Research Institute. I initially knew how important mental health was and how trauma can be such a hindrance to a person's life and development. But I feel as if the book provided an even deeper understanding and insight, further solidifying the importance of mental health to me. Some valuable insights that I gleaned from this book were that I was able to understand in a more deeper way of what trauma was, how it affects the human body, and how to heal from it. So on this slide, I talk about my research and I reflect on my resources. First and foremost, my first understanding of trauma came from my own firsthand experience, where I became acquainted with the symptomology. As a survivor of abuse, I liken the trauma that I experienced to how Jabba the Hutt kidnapped Princess Leia. The next researcher, I found 3 researchers that I thought were interesting and had interesting research regarding trauma and abuse. The first researcher was Dr. Stephen Hassan, who came up with the BITE model for authoritarian control, which stands for behavioral control, information control, thought control, and emotional control. The second researcher is Dr. Margaret Singer, who was a cult researcher and published the book Cults in Our Midst, and researched phenomena such as religious trauma. The third researcher was Dr. Robert J. Lifton, who coined the term thought reform, which can be synonymous with the phenomenon of brainwashing. These 3 researchers all provide an understanding of different forms of trauma, from psychological trauma, emotional trauma, control and abuse, from an individual level all the way to a institutional and organizational level, and how it impacts not just the individual, but also can impact communities as a whole as well. So using the ecological model, we can see that trauma has an impact from a wide range, from just an individual level all the way to a mass, like a public, whole communities can be impacted by trauma as well. These are my references, and this is it. Thank you so much for watching. Take care.